WSOT-TV at 5:30 p.m. and again at 10:30 p.m. and additionally on Sunday, May the 31st at 10 a.m., 5:30 p.m. as well. I also would like to let you know that here on WSOT-TV we will have the privilege of broadcasting the Marion High School graduation at 2:30 p.m. on Sunday, May the 31st. And then later that day at 7 p.m. we will get to broadcast a senior tribute to the class of 2020, and we hope that you will join us in celebrating the great accomplishments of these students. Now, today you will be hearing from Bob Jackson from the Grant County EMA, Mark Bardsley, Grant County Commissioner, Dr. Brad Lindsey, Superintendent of Marion Community Schools, Sarah Evans from Marion General Hospital, Dr. David Moore from the Grant County Health Department, and from Kylie Jackson, the Marion Grant County Chamber of Commerce. Up first is Bob Jackson. Welcome.
Thank you, Angela. Good afternoon, Grant County. We'll bring you up to speed with an update from the Emergency Operations Center. We are on operational period 77, and as of this morning, the Grant County Health Department is reporting 240 confirmed cases that we have had in Grant County with 21 deaths. I'm sure Dr. Moore will speak more to that. The number of cases of COVID-19 in Grant County in the past 14 days, we look at a 14-day period as we try to plan ahead for our next actions. So looking at a 14-day period, we have remained steady. As things begin to open up, that's a good sign. We're a little higher than what we were previous to that, but we knew with the testing that was going on that we would begin to see more cases. However, there isn't any more people going to the hospital than what we had before. Actually, maybe less. MGH can speak to that, but that has remained fairly steady, which is a good sign for us. With that information, we have changed our incident action plan. That's the plan that we use in the EOC for planning for, we use this for any emergency that would happen in the county. We've used this throughout the COVID pandemic. So we will continue to support life-sustaining operations, food pods, homeless shelters, those kind of things. We still report and look at that every day. So always make sure that we keep an eye on that. Critical infrastructure, resources, just to maintain what we have, that the county is always prepared to deal with any other thing else that might happen while this pandemic is going on too. Critical emergency services, and at this point we are beginning to engage the financial sector within our emergency management system. And what we do now is we're looking for grants. There are some opportunities out there to reimburse the county, hopefully for some of the expense that we have put out. FEMA, our federal partners, are releasing funds. However, there's a lot of paperwork involved with that, as you might imagine. So we have folks working through that process, and we'll continue to, hopefully that we can regain some of those finances back into Grant County. And there again, lastly, assisting local government and civic organizations. I'm sure the commissioner will speak more to that. The commissioner's office is heavily involved with planning. As we move forward, we want to make sure that we are doing the right things, that we're still maintaining control over the pandemic as much as we can. So a lot of guidelines have to be looked at. We are reviewing plans as requested by organizations and different government entities in the county. We're happy to lend a hand, an extra set of eyes as we move forward. We want to make sure that we're doing the smart things and what we have to keep everybody safe. With that, and I'm sure Dr. Lindsey will speak to the food distributions at Marion Community Schools is ongoing and looks like we'll probably go through June. There again, we'll monitor everything as we go, but we're at least scheduled or prepared to go that long. Second Harvest will also be doing their food distribution, their tailgates at 5 Points Mall for the next, all the Tuesdays in June are they're scheduled for, so that will continue. All of those are still at 10 a.m., so nothing changes there. And just lastly, we have had tremendous support from a lot of different agencies, so I'm going to attempt to name some here, and I apologize if I miss anybody, but all the jurisdictional first response agencies in Grant County, the Indiana State Police, Grant County Highway, Marion Utilities, Gas City Utilities, Indiana Michigan Power, American Red Cross, Salvation Army, United Way of Grant County, and Hands of Hope are just some of the organizations that have assisted us. And when you think about all the things that still have to keep going on, we still have to have the lights on, the water flowing, those kind of things that regardless of what happens, we can't take a break there. So rest assured, we continue to monitor that. We will continue as we move forward, and that is the report from Grant County Emergency Operations Center. Thank you.
Thank you, Bob. It's comforting to know that you are still monitoring and keeping an eye on things as we reopen our economy. Joining us next will be Commissioner Mark Barkley.
Thank you, Angela. It's good to be with you. Greeting to you and yours this afternoon. As we have just heard from the EMA director, the positive cases stands at 240 with 21 deaths in the county. Indiana currently, when it comes to the mortality rate in the state of Indiana, is right at 5.5%. Grant County is a little above that curve in that we're at about 8.5% on our mortality rate. And that statistic is, again, positive cases and the amount of deaths that we've experienced here in the county. We are continuing to see positive tests in the county. That's to be expected. The more tests we do, the more people we find that are infected. That way we can treat the sick, and we can also take care of maintaining our healthy standards as well. With these numbers in mind, in the state of Indiana, we are moved in already to phase 3 when it comes to the governor's Back on Track program. But I want to emphasize this, and please understand, COVID is not gone. COVID virus is still out in our community, and we need to be careful. We need to continue to use practices that help to promote positive hygiene. We have, in fact, flattened the curve over the last many weeks so that the Indiana healthcare system can treat patients as they come in and are needing of extraordinary life-saving measures. That, coupled with the stalled economy and the direction of the local and state and federal economy, we're ready to move in to that jump start. There are many who have tried to demand an earlier type of start to this, but methodically and cautiously, we have developed this approach. It's kind of letting us test the waters as we work through opening businesses, opening government, interacting with folks. And we're building momentum, taking us into the summer now, and we're excited about that. Just want to remind you, Hoosiers 65 and over that are a part of the high-risk medical condition group, please limit your exposures in the community for your well-being and safety. Continue to remote work if possible. And again, as you are out in the community, make sure that you're using face covers as recommended. Social gatherings of 100 are permitted with that social distancing and proper hygiene. The coronavirus is often spread among larger groups in confined areas in which there's a lot of transfer, touching of tables, common areas, that type of thing. And so we just need to be cautious as we move out into our normal again. Again, I want to remind you that assisted living facilities and nursing homes will continue to not allow visitors. They're continuing to keep their community as safe as possible, but there are no travel restrictions. You can go where you want to go now. That's a part of this phase 3 in the state of Indiana. Again, I would like to thank you because your active participation in that stay-at-home order over the last weeks has helped us to flatten that curve and has helped us to move forward so we can get the economy going again. I'm happy. I'm excited about us moving again. We just need to keep physical distancing in mind and those hygiene practices as well. With regard to county government operations, according to Governor Holcomb's plan, all government buildings and services will be accessible to Hoosiers. Here at Grant County departments, they are functioning and are available. If you cannot do your work over the phone or online with getting those forms that you need, you may call and contact departments that you need to work with, schedule an appointment, and then they will get you in so that you can do the work that you need to do. Again, under the guidance of CDC directions, we will check your temperature. We will also ask some questions about your health condition so that you can get up and do the business you need to. You'll be needing to have a face covering as well as you're in the county buildings for a while. I want you to also be reminded that next week, June 2nd, is the primary. I just talked with Clerk of Courts Pam Harris, and she wants to reinforce that if you have absentee ballots out at this time, they need to get back into the mail immediately, or they need them by Monday at the latest, or you can walk in your absentee ballot at the latest by noon on June the 2nd. I was also asked to remind that there's inspector training going on in the county council chambers tonight for our poll worker inspectors. That'll be at 6 p.m. And then tomorrow night, the clerk and judge training that will be going on at 6 p.m. That'll be at College Wesleyan Church. And that training's for tomorrow in preparation for those who come out to the polls on June 2nd. Again, don't forget, if you haven't done your 2020 census, we want you to do that online or fill out your paperwork and get that back in, because that's important to Grant County, the city of Marion, Gas City. All of our municipalities receive government aid and grants and funding because of what we find out in that census. Also, we still have until July the 10th. If you haven't gotten your property tax in yet, you can still do that without penalty, and that's good. I talked to the treasurer today, and most of the mail-in payments have been processed now, and we're hoping to see a good 94% participation in our property tax assessments for this spring. Now, there's been talk in the media and health officials, their circles, of the possibility of a second wave of this coronavirus, and nobody wants to hear that. But just a thought as we prepare, if we have to. What have we learned that would help us in a second round if we had to face that COVID virus again? First of all, the Federal Emergency Management Agency, FEMA, has for many years encouraged all families, whether you own a home or an apartment, wherever you live, all families to have at least 3 weeks of supplies that you would need in the event of a tornado, of a snow emergency, of some other type of natural event. So we can think about that and always have a little bit of extra in reserve. We've also learned that with God's help, with our family, with our friends, that we can make it through a disaster event and keep on going. We're almost through this. I really believe that. But we can do it together. Also, I think some of us have learned a little bit more patience, and that whole virtue that we need to deal with our family and friends as we go through tough times. We've also learned that life is precious, and we need to celebrate it in every stage of the earthly experience. From the youngest to the oldest, we're grateful to God for that life. Again, on behalf of Grant County government, we very much appreciate our media partners that have helped us get this information out to you. And just my closing thought for today, God said to Joshua as he was taking leadership as Moses was finished, that was a new start, a new beginning. He said, be strong and be courageous. As we move back into normal living with our health and the concerns that are going on, with all of our family, the needs for our community, just want to encourage you, be strong and courageous. Be steady. Be safe. Thank you.
Thank you, Commissioner Barkley. And I'll echo his appreciation for our local media. You know, the Chronicle Tribune, the News Herald, WBAT, Layla Price with the City of Marion. They've all helped us as we've tried to help share the word of what's going on during this pandemic time. So thank you to our local media for helping to keep us informed. Now, next, I would like to invite Mayor Jess Allenball from the City of Marion to share with us.
Thank you, Angela. This will be kind of brief. I don't have a lot of changes from last Wednesday. We do have one change. We have expanded our bus transportation department services. If you can call expanding services, we are now allowing up to 6 individuals on the bus at one time. We're doing that because there are more options for them to go to now. They may just need to go get a haircut. I just got a haircut yesterday evening for the first time since February, and it feels great. So those are some of the things we're doing. With 6 people, it's still by appointment only. You need to call 24 hours ahead, let them know where you need to go. We'll make those arrangements with you and get you where you need to be. Another thing that we're doing is you may see some action at the Garden House. I touched on this a week ago. If they're having events at the Garden House, it's because they're doing it within the criteria the state has mandated. And we're expecting them to wear masks and practice social distancing during these events. So don't be alarmed if you see those happening. We are regulating those based on the number of people they're expecting at the event, and we're making sure we meet the criteria. And finally, I would say to you, I'll have some press release, probably about 2 or 3 this afternoon, that I'll release to all the local media. I get a lot of questions about the softball league, the splash house. I'll have that information and share it with you here this afternoon. Please check in on our social media page there, City of Marion's social media page, but also our city website. We'll have that to you. That's one of the biggest questions I'm getting now about the recreational activities, what's going to happen with those. You'll get that information this afternoon. Most of all, I want to encourage you, reach out to some of your elderly and kind of touch base with them. If you know somebody in your neighborhood that's elderly, kind of on their own, especially those that are by themselves, they seem to be struggling the most with the depression or just the frustration of this pandemic. Reach out to touch somebody, random act of kindness. Those are beautiful things. Reach out to somebody in your community that you know is by themselves. Let them know you're thinking of them, that you love them, and are praying for them. Continue to lift our city up in prayer, and we will get through this together. God bless you.
Thank you, Mayor Allenball. And next, I would like to invite Dr. Brad Lindsey, Superintendent of Marion Community Schools. Welcome, Dr. Lindsey.
Thank you. Angela, don't you just love the people of our community?
I do.
This is such an awesome place to live.
It truly is. It truly is. And I'm really looking forward to graduation this weekend.
I can't wait. And thank you for leading us off. This Sunday is exciting because we're finally celebrating the class of 2020. They're such an awesome class. Record holders on college credits earned and scholarships. So beginning at 2:30 online, the video celebration begins, the class of 2020. Also, Angela, that night at 7 o'clock, what we're calling it Senior Spotlight, is giants from across the globe honoring, spotlighting our seniors with music. And so it's really going to be entertaining and a lot of fun. Beginning this Monday at Marion Community Schools, our Marion Giant learning apps are available. If you get online and look, any questions with our principals or Scott Hoeksma, our Chief Academic Technology Officer, our students and families can tap into those learning apps all summer long, beginning on Monday, June 1. In Marion Community Schools, for the second straight year, we do have one-to-one device capability. We will be expanding our Giant Online Academy. What we want to do is we want to meet the needs and preferences of our students and our families. We love our Giants. We're so thankful that you're Giants by choice. And so where your needs are and your preferences are, we are prepared to meet those. So please stay connected on our website and with principals and Mr. Hoeksma. This Monday, June 1, from 11 to 1, any families that would like home learning packets for the summer, you can pick those up at the high school, 11 to 1 this Monday. Food distribution, again, went well. Angela, we're now over 400,000 meals served.
Wow.
And
That's
so
an outstanding number.
it's a great number. We're so thankful for the community support to make that possible. We're going to continue to do so through June 24,
June 24th.
8:30 to 10 in the mornings, as it's working very, very well. School facilities and campuses are back open, the governor and also Department of Ed. So student activities can begin in facilities and on campuses beginning July 1. And boy, are we excited, because we've got some exciting things planned, and we can't wait to have our kids back on our campuses. And I know schools across the state are super excited about that.
I'm sure a lot of families are.
Again, we love our families. We are prepared to meet the needs and preferences of our families. Stay connected with us. Thank you for being Marion Giants, but more importantly, we just ask everyone, continue to be safe. Thank you for being patient, caring, and kind. Thank you for being great neighbors, and may God's blessings be with us all. Thank you.
Thank you, Dr. Lindsey. And again, I would just like to restate that we will be broadcasting here on WSOT TV Marion High School graduation at 2:30 p.m. And then again at 7 p.m., as Dr. Lindsey just mentioned, we'll be putting the senior spotlight or senior tribute on here on WSOT. So that's something that you can find here and you can find online through the school's resources. Now, I want to invite Sarah Evans from Marion General Hospital to share with us now.
Thank you. Much of the focus has been on COVID-19 over the last several months. However, at Marion General Hospital, we have remained focused on the healthcare needs of all of our community members, and doing so in a safe and effective manner. In doing that, we have adjusted our processes in our primary care offices, the MGH Express location, our emergency department, and also our clinics available for surgical services and inpatient services. All individuals entering our facilities are screened for symptoms of illness and any signs that they may be experiencing. And if they are experiencing that illness, then following that screening process, they are seated in a designated area to separate and reduce risk to other individuals that are in our facility. After we've operated in this manner for several weeks and months, we are happy to report that these plans are working well. And we want to encourage anyone who is needing to seek medical treatment to not delay, as that could actually create hazards to their health if you do not seek timely treatment. So please be assured that it is safe for you to come to our facilities to seek medical services that you're needing. As we do work to resume normal operations at all of our facilities, we are requiring all individuals to wear a face covering as they enter into our facility, and a cloth face mask is provided to each individual if they do not present wearing one themselves. So this is where you as the community can help us, and that we are seeking donations for cloth face masks so that we can continue to be able to provide those to people who come to our facilities. We have received feedback that those individuals presenting would prefer something in a plain color, and the elastic for the ear loops is preferred rather than those that tie, as that is easier for our customers to wear. And those people have expressed that they would be much more likely to re-wear that at other businesses in the community. So it would create a safer environment as they go about their other business in our community. So we appreciate donations and the time that it takes to help make those cloth masks. We will be accepting those donations at our main hospital, main entrance location, Monday through Friday from 8 to 4. We will have someone available to receive those. And just once again, on behalf of Marion General Hospital, I want to thank the community for their support and generosity throughout these last several weeks. We have been truly overwhelmed with positive appreciation and words of encouragement as we have faced this challenging time together. And so we just want to continue to thank you for your support and appreciation as we continue to meet your healthcare needs. Thank you.
Thank you, Sarah. And again, just to repeat what she shared, if you would like to donate a cloth face mask, you can do so by going into the hospital's main entrance Monday through Friday, 8 a.m. to 4 p.m. So if you would like to help meet that need, please don't hesitate to do so. Joining us next will be Dr. David Moore from the Grant County Health Department. Welcome, Dr. Moore.
Thank you, Angela. Appreciate it. And thank you and for all of it. It's a pleasure to be here. The Emergency Operations Center in Grant County in response to the COVID started 77 days ago. And it seems strange, but it's been that. And there's been a shift from panic to plan to now looking to see how do we go to the next phase. And it's exciting after being cooped up for so long after the emergency shutdown order come to look forward to getting out. And we want to remember that this is still a medical condition. This is still a reaction between the human body that we have and the virus that has come and invaded our country. That we know that shutting down helped to bring it under control. And as we go through a phased opening up, it isn't that if we go slow that it'll be okay. It's if we go slow and we pay attention to what works and what doesn't work, that then we'll be okay. If we see that we're doing something as a community and it's creating an increase, a surge or other sort of problem, that means that we need to back and to be willing to listen to the guidance that we're getting from our state, as guidance that we're getting from our local officials, that we're saying that we've started this activity. It's wonderful. We've looked at it. We've measured it and monitored it, and that's one of the primary jobs of the health department, to look to see how are we doing, are problems coming up. If it's safe, then we go to the next step. And if it's safe, we go to the next step. But if we see problems going on, then we're going to try to work with you and with our government to understand where they're coming from and what we can do to begin to make it better. It is exciting after being cooped up, but we need to do it right. We don't want to overwhelm the system. We want to flatten the curve. But as the others have said, we've learned a lot, and we've learned a whole lot through this time. There's still bunches that we don't know about this virus and the way the human bodies, but we've started this out at the beginning of the year knowing next to nothing. And we begin to understand how it spreads, how it can be treated. Ultimately, our freedom doesn't come until we have a vaccine. That's a ways away. That's not next month. That's not because we've been tired of being cooped up. It's when we have a vaccine, similar to what smallpox was a century ago, that once a vaccine became available, something that was wiping out the population was brought under control. COVID will be similar to that, I believe, with that. There's going to be treatments, there's going to be other things, but it's a droplet spread event, and that if you're close enough, the droplets can get to you, or that your droplets can get to others, then it can be spread. At least half of the people in the population who carry the COVID virus have no symptoms. They don't even have temperature elevation. It's out there, and we have to practice social distancing and do things to keep the droplet spread. So at the beginning of this, we were making big distinctions between which kind of mask was there. And for those who are in the hospital, that's what we need to do. But for the rest of us, it's a matter of protecting them from our droplet spreads, of taking care of one another. Because different regions of the state have been affected differently by this virus, but also different segments of our population. And you heard them talk about the elderly or the more vulnerable, those who have coexisting conditions. Because if you're well and you can carry it and be without symptoms, you could take it to someone else, someone that you may know or someone that you don't know, and you could have fatal outcome for them. So this is something that we do together, that we thoughtfully and patiently, that we learn along the way, but we do this in the way that we're taking care of not just ourselves, but we're taking care of our community. There will likely be a next wave, and that next wave will be when the flu comes on top of the COVID that occurs. And so that essentially sets people up with a coexisting condition. Weaken from one thing, more vulnerable to the other. And for the flu, the best thing that we can do is a vaccine. Maybe the vaccine is only 50% effective. Hopefully it's 75 or 80%, but maybe it's only 50% effective. That's going to be, for those for whom it protects, is going to be lowering that coexisting condition. As we learn, as we begin to open up our society, what are some of the things that cause spread or that prevent spread? As we learn that and we start to exercise those when this next wave comes, that we will be ready. We will have supplies available, personal protective equipment, respirators that are available, some of the antibody tests that I think we mentioned last week, that the hospital has been using to take antibodies from a person who's been infected and recovered, convalescent antibodies and treatment. We're going to learn more about that. So we're going to continue to learn as we go towards this. This has been a devastating thing. It's been hard on people psychologically, been hard physically, it's been hard economically. We're going to get through this. We're going to get through it together if we take care of one another. Continue to look out for one another, continue to pray for one another, and Marion, Grant County, we can do this. Thank you.
Thank you, Dr. Moore. We appreciate you. Always insightful information that you share with us. And next I would like to invite Kylie Jackson, she's the director of the Marion Grant County Chamber of Commerce, to join us today. And I'm excited, Kylie, as our economy is starting to open up. I know that the Chamber has been there through the whole process. Mm-hmm. And for folks who may not be aware, Share with us a little bit about the Chamber of Commerce and what it is that you are able to do for our local businesses.
Sure. So the Marion Grant County Chamber of Commerce, we are a nonprofit. We are a 501c6. Some people think we may be, a function of government or something like that. We're not. We are a membership-driven organization. So businesses pay membership dues to be a member of ours, and then we are there. Our mission is to enhance and support business growth in Grant County. So that's really all we do. Everything we do is pointing towards that mission. So we did that in a lot of ways. I think if you've heard of the chamber, it's through a ribbon cutting or something like that. That's just a small piece of what we do. We do a lot of education, sales and marketing seminars, human resources seminars, things like that. We do advocacy on the local, state, and national level, and then business support. So that's really what we've been doing a lot of in the last couple months. So a lot of online help, things like that, but a lot of one-on-one conversations during this time.
I would be curious
Yeah.
to know, as you talk about business support, I know from talking with you prior, you have maintained close contact with our local businesses. What are you seeing as you're out and about and communicating, and how have you been able to help our local businesses during this unprecedented time?
Yeah, so I think it's transitioned some. The first couple weeks were triage, really, helping our businesses. All businesses have some sort of emergency plan. But no one was planning for something like this.
Right.
So helping them understand what we were facing, the uncertainty of the timeline was really difficult for a lot of businesses to plan for. So our immediate response was one-on-one conversations with
Right.
businesses. It changes from industry to industry, what they're facing, what regulations they're facing. So we did a lot of education. We did a lot of helping with the PPP and the EIDL, all of those SBA programs. We very quickly became experts on those topics. So helping our businesses can just kind of be a funnel to help get them, they're busy trying to run their business.
Yes.
So we're there to just try and funnel things through and filter and make it easier for them. So we've created a resource page on our website, as well as a back to business toolkit. So those are some of the, as we pivoted from that initial triage and what do we do next, and we start to aim towards recovery, those are some of the things we've put in place in the last month or so. So like the Back to Business Toolkit.
Yes, tell me a little bit about that.
Sure.
I'm curious.
Anybody can go on our website and find that document. I think it's about a 20-page PDF document, and it kind of lays out a lot of the state guidelines, and then also what businesses checklists, what they should be looking for, how they should be talking to their employees about this. It includes a lot of signage, like pre-made signage. So if you need
Helpful.
a sign on your front door that says, this business has a COVID-19 plan, here's what that entails, here's our maximum occupancy at this time. All that stuff is in that toolkit. There's also a lot of, social distancing signs, that kind of information. So that's all included in that toolkit, and we're happy to be able to provide that for the business community.
COVID-19 plan you mentioned. I would be curious to know, local businesses, as you have had a chance to talk with them more regularly, what are you seeing? What kind of efforts are you seeing local businesses make to prepare for customers as the economy is reopening?
Yeah, it absolutely varies industry by industry, but what we're finding, the number one thing is that the public and customers value that transparency. So whatever it is that businesses are doing, we would just encourage you to reach out to those businesses, reach out to their social media, call them. They have a plan, they care about you as their customer, and ask them about it. I've heard a lot of radio ads lately, with businesses talking about, here are the ways that we are, whether it's social distancing measures or sanitization measures. Businesses care about you, the customer, and that's what we all need right now. We all need that transparency. We need to know what the plan is, how the business is going about that, and just build that trust, and so that we can get the economy going again here locally.
Good. Well, Kylie, I appreciate that you took the time to come here today, and I am hoping that maybe we can have you join us again in the future. Maybe we can start maybe spotlighting what some of our local businesses here are doing as the economy reopens.
I would love that. Thanks for having
Wonderful.
me.
Thank you for coming. Well, as we wrap up today's community update, I would like to remind you that it will be rebroadcast later this afternoon at 5:30 p.m. and then again at 10:30 p.m. And then also on Sunday, May the 31st at 10 a.m. and 5:30 p.m. I also would like to say a great big thank you to WBAT, the Chronicle Tribune, and the News Herald, and Layla from the City of Marion for helping to get this information out to you. And one final reminder that the Marion High School Class of 2020 graduation will be broadcast at 2:30 p.m. on Sunday, May the 31st, and then a special senior spotlight, a senior tribute will happen at 7 p.m. And that is something that the school is going to be putting out through their media, as well as something that we have the privilege of broadcasting here on WSOT TV. Well, that's all we have for you today, and I thank you so much for watching. Stay tuned for some more quality family programming that you can trust right here on WSOT TV.